As thousands of children head back to school this fall, coronavirus restrictions are easing.
The New York City Department of Education announced changes last week. Starting in September, daily health screenings will no longer be required. Students who take part in high-risk extracurricular activities must be vaccinated, and students who test positive will have to isolate for 5 days before returning to school. Governor Phil Murphy announced similar changes in New Jersey school districts.
But the COVID-19 virus is still with us, and many parents have concerns. Dr. Delaney Gracie joins us now to sort through the new guidelines. She's a practicing pediatrician and director of clinical services for the school health program. Good morning, Dr. Gracie.
Good morning. How are you?
Very well, thank you. And what are the best practices for parents now with regard to COVID-19 in children? I mean, should they wear masks when they return to the classroom? What's your thought?
So I think the biggest things is, getting your kids vaccinated. That's the most important thing we can do to protect ourselves and our kids. So we strongly recommend that. In terms of masks, they're not required to wear them all of the time. But as you mentioned, if they have had COVID, once they come back to school in that second 5 days, they should be wearing them. You should consider wearing them in large groups, or if you believe that you may have been exposed.
So, Doctor, daily health screenings are now no longer required, but should parents still test their kids regularly? And if you think so, how often should they?
I don't think you necessarily need to test them regularly, but you would want to test anytime that you think they may have been exposed, anytime they start to have symptoms, even if they're very mild, or you can consider testing if you've been on an airplane or in a large group activity.
And so many symptoms for COVID are similar to the flu. What would be the determining factor to keep students home? Is it fever?
Well, I mean, as you say, the symptoms overlap a lot. But again, even if a child has flu, they don't need to be going to school because that can be spread as well. So certainly with both, if they have fever, they should stay home no matter what they have. If they have a mild cough, mild runny nose, it's great that now we have the COVID tests, so we can test and see if they have COVID or not. If they do, obviously they need to stay home. If they don't and their symptoms are very mild and they don't have fever, they may still be able to go back to school.
Now, if a child tests positive, they can return to school, let's say, after day 6 without symptoms. But what should parents be on the lookout for?
So you really want to make sure that, it should be 5 days after they either started to have the symptoms or tested positive. You shouldn't have had fever for 24 hours without any fever-reducing medications to go back to school safely. And their symptoms really should be significantly better. So if they still have a really runny nose and have to take off their mask to blow their nose a lot, or if they're having a lot of cough, they're not ready to go back to school, even if it's after the 5 days.
And finally, let's talk about monkeypox. Are you concerned this could impact children? Are there any precautions parents should take here?
Sure. I mean, it's definitely in our community now. It's still extremely low risk for children and adolescents. If you have been exposed to monkeypox or have a household member with monkeypox, or your child has a rash that you find concerning, the best thing to do is contact your doctor and they can advise you and do testing if needed. But the risk is still really, really low for children and adolescents.
Well, Dr. Delaney Gracie, pediatrician and director of clinical services at Montefiore School Health Program, thanks so much for answering our questions this morning. We appreciate it.
My pleasure.
All right, good to talk with you. And for more information about school COVID guidelines, you can go to our website, cbsnewyork.com.